Now I would invite Dr. Rakhi for a keynote address, The Eye and Tick-Borne Diseases, a study from South India.
So good morning, everyone. Dr. Rakhi and I will be talking on a paper on the tick and eye manifestation, a study from South India. So the objective was to study the ocular manifestations and complications following tick bite. So we analyzed all the cases that presented to us with tick bite during the monsoon seasons in South India. All of these patients were residents of Kerala. We did a detailed ocular evaluation, fundus evaluation, followed up all of these patients at very frequent intervals to monitor for the systemic manifestation. A liaison with a local physician and a microbiologist was created in order to refer, treat, and follow up all the included patients. So the primary outcome was to study the ocular manifestation. Secondary outcome was to find the chances of development of systemic manifestation and to find the efficacy of prophylactic antibiotics. So we had 23 eyes of 23 patients, unilateral. Higher incidence was in the monsoon season. BCVA ranged from 2020 to 2000. So out of this, the period of presentation of the tick bite was nearly 5 days. And tick was present in situ in around 13 eyes. It was live in 10 cases. Associated fever was there in 7 cases. Mean period of development of fever after the tick bite was 7 days. Most common symptom was eyelid pain, sign was eyelid edema, self-removal of tick was attempted by 10 patients. Non-granulomatous anterior uveitis was seen in 5 cases. Mean period of development of uveitis after the tick bite was 11 days. One case presented as a conjunctival nodule with a dead tick had severe uveitis. So prophylactic antibiotic prophylaxis with tab doxycycline was taken in 16 eyes because, as you all know, Kerala is very endemic for all sort of tick bite in manifestations. So 5 eyes presented later with NJU and 4 cases with retinal involvement. 1 case of a 78-year-old male present with NGAU, vitritis, and macular edema. Actually, in this patient, there was parts of the head recovered from the eyelid nodule with surrounding ulceration, and that is why he had a severe manifestation. So these were the pictures of few of the patients who were presented to us. So we tried to identify the species. It was possible only in 11 cases, and the most common species was Ixodes. But what we found that whenever it was the dog tick, that is the dermacenter type, it almost always led to fever, even if not given prophylactic treatment, antibiotic treatment. 4 presented with retinal findings. One of this that presented with retinal finding still has a residual lid edema, and the eye pain was accentuated by ocular movements. History of myalgia and mild fever 2 days prior to the onset of defective vision. These patients were sent to the physician and was started on tab doxycycline along with rifampicin and also low-dose steroids for 4 weeks. Steroids were very slowly tapered. So ticks, as we all know, ectoparasite can cause various life-threatening diseases like Lyme disease, tularemia, rickettsia, Q fever. Mostly they are reported from US and Europe, but it is not uncommon here. It is rather underreported. Clinical awareness is very much needed. It is easily overlooked. Serological testing is limited in these cases. So why do they prefer the lids? So they habitually enroots lids because there is this meibomian gland orifices, and also they present like a mass that mimic the appearance of a hemangioma, nevus or epidermal cyst, and it can be easily missed. And because the lid area, the tick has a fondness for this warm, moist environment. And the possibility that ticks can easily travel through these eyelashes, and then it can masquerade itself within this lid, black pigmented area of the lid is another reason why they prefer the lids. So how it gets its bloody meals. So what the tick does is, once it bites, it inserts its hypostome and it secretes certain cementing materials into the skin. And this material has got certain anticoagulants, immunosuppressives, and anti-inflammatory substances which help it to get a effortless blood meal without the host noticing. So there can be various manifestations. Almost all manifestations can be possible after a tick bite. So how to remove? The best method to remove is to do either an en-bloc excision or to remove with a blunt, medium-tipped angle forceps. People have used many other methods like petroleum jelly, gasoline, betadine, but actually none of this should be done because if we are going to use sharp forceps, so if we are going to twist the head, it is going to emit that body materials, which is actually potentially infectious, and that can lead to zoonosis, specifically Lyme's disease. So to conclude, most common site of tick bite was near the lashes. Commonest symptoms was eyelid pain with edema. Incidence of systemic manifestation was 7 in our case, and mostly with dog tick bite. Posterior segment involvement was also there. So as in our population, it is advisable to start prophylactic tab doxycycline in all the cases, since the chance of development of complications is still unpredictable. Thank you.
Nice presentation.